Assalamu alaikum to all the audience. My name is Dr. Kemal Ibrahim. I'd like to welcome you to the program and thank EMCA for having us. So I'm representing EritreaHealth, which is an organization which is trying to empower the Eritrean community in the UK and internationally through different mediums such as social media, YouTube videos and Facebook and other mediums to educate themselves about health related issues. So I'm very delighted to invite a friend and colleague as a doctor who is Dr Mahmoud Muhammad. He studied at Imperial College London. He works as a general practitioner, a GP in London, UK. And he has a special interest in dermatology, which is the science, the medical science related to illnesses of the skin. He studied a bachelor's, in addition to qualifying in medical school, he also studied Bachelor of Science Degree in gastroenterology, where he did some research briefly into fasting and the impact of the body. So this is a perfect type of seminar for him to go through. And so I'd like to, without keeping you waiting, introduce you to the doctor and allow him to go through his program and presentation. And after that, inshallah, I would like to invite all of you to leave questions and answers. The best place to do that will be in leaving comments in the Facebook Live box. Alternatively, inshallah, when the question answer time starts, we will leave a phone number. If you wanted to call in and directly talk with the doctor and ask the question, we'll leave a phone number with our meeting ID that you can use and a password to get in and speak to the doctor. So I'll hand over to Dr. Mahmoud and I'll mute myself, inshallah.
Jazakallah khair for the generous introduction. Kemal is a colleague of mine, as we said. I appreciate the efforts he makes as well, mashallah, in that regard. So without further ado, the talk today is regarding fasting in Ramadan. So what I would like to do is go through a few things once I've got my slides, the slideshow active. So Bismillah, Alhamdulillah, wassalatu wassalam ala Rasulullah. So thanks once again for the opportunity to EMCA and Dr. Kemal for organizing things and Abu Moaz. So, okay, so the topic is fasting and health. So there's a few questions that I sort of asked myself when I was preparing this to try and make it as beneficial as possible. The aim is to try and keep things simple and inshallah make sure that we all take away something, and I remind myself of certain things that I should be doing as well in that regard. So I have a few key questions that I want to try and answer for you all that I think will be very useful. Number one, what happens to the body when you're fasting? Number two is, what are the benefits of fasting? And this is more the health related benefits, as opposed to, we know a lot of the Islamic benefits and the spiritual benefits in that regard. So this is, in addition to that, we're focusing on the health benefits today. I asked myself the question is, can fasting harm you? And I wanted to look at ways in which fasting can actually be harmful from a health perspective, again, rather than a spiritual perspective. And then I wanted to discuss some common scenarios, and I put there just to remind myself and yourself that fasting is a good opportunity to give up on bad habits. So carrying on. The body essentially, when it comes to food, the body has two states essentially. Number one is the fasting state, and number two is the fed state. I'm keeping it very simple. So one situation is you eating, and the other situation you're fasting. So these are two scenarios that the body is going through from a food perspective. To be able to understand the impact of fasting, I think it's very important to understand what's going on in this regard. So when we are fed and we're eating normally throughout the day, our body is producing a hormone called insulin. Now, we may have heard of insulin when it comes to diabetes and how some people need more insulin, and that's why in diabetes they're injecting themselves with insulin. Now, the body has its own natural hormone called insulin anyway. And this hormone is secreted or into the blood at a high level when we're eating, because we need the insulin essentially to break down the foods and make sure that we are processing the food. So when you've had a meal, you've had a burger or whatever you've eaten, it gets, your bloodstream essentially gets a slight rise in its sugar level, and then your body becomes aware that there is more nutrients in the bloodstream, and so insulin is secreted. Now, this insulin helps to break down the food and organize it. So it breaks down certain foods into sugars, simple sugars, and sugars are like the petrol, essentially, of the body. It's the energy currency of the body, glucose, and it breaks it down to really that energy component, and it gives you the energy, and you might feel a bit more energized after we break our fast, for example, when we've had food. It's because of all of that glucose that's been broken down by the insulin from the food, and it's rushing around in our bloodstream. The second thing that happens when you're eating and with the insulin is that essentially when there's too much, usually there is more than what's needed. So the body decides to organize the nutrients that it's got inside in storage places. Now, the common storage place is the liver to start with. And once the liver is maxed out, the body starts to organize some of the foods or the carbohydrates, the sugars that we're focusing on, into fat. And that's how the body builds up fat around. So fat is essentially, you've got excess storage, and that's been organized by the insulin. So this insulin hormone is a very important hormone when it comes to organizing food in our body, that we will see more and more of throughout this presentation. Now, let's take the other side of the story, the fasting state, whereby your body is fasting. It hasn't had many nutrients for a while. So the glucose is low, essentially, in that situation. And the insulin is obviously slightly lower, and your body's breaking down fat in that situation. So to start with, it breaks down the stores in the liver. And if you fast long enough, it will break down the store. Eventually fat starts to be broken down. So this is what happens in the fasting state, essentially. So these are the two sides of the coin. Now, what we found from a medical perspective is, moving on to the next. So what we found essentially is if you spend your time or your life more in the feeding state, so you eat too much, in brief, and you over time, what happens is the insulin in your body is not working as well. There's more fat that the insulin has to work on to try and organize things. And we found that there is a concept called insulin resistance, whereby the insulin is not working very well in the body. Now, when the insulin is not working very well in the body, there's more sugar going around in the blood, and that sugar is not coming down. So you can see where diabetes comes in. So when your insulin is not doing a good job, the sugar in the blood is higher than it needs to be. The body is not breaking it down. The body is not storing it away. And so you're more in a diabetic state. Now, this insulin that's not working very well causes other problems around the body. So it causes problems to the heart, we know. It causes several problems, even to the kidneys. Several organs are impacted by a state of essentially insulin resistance, we call it. And that's in situations where we're excessively eating too much, number one. The other situation where insulin resistance, insulin not working properly, is when we don't exercise much as well. Because we know that exercise is a big component in making sure that insulin works well. So in essence, God has given us an opportunity when it comes to fasting to try and maybe regulate that situation better. And we know that when we're taking in less, when we're in the fasting state, what happens is the insulin is more effective. Essentially, you're taking in less. Overall, the calories for that particular day is less, and so the insulin is more effective, and generally there's less damage essentially going on around the body. So this is a good summary slide of what we've sort of discussed in a way with regards to, insulin resistance and some of the benefits of fasting that we're coming on to. So number one, we said that the insulin is better, and that's better for your body because the sugars are broken down better, so less likely to be diabetic. But there's also less overall inflammation, we know, in the body when it comes to fasting. And inflammation, essentially when something is inflamed and sore, we know is bad sometimes inside the body. When there's a lot of inflammation going on, it's bad for the blood vessels, and it causes us health problems. The other benefit of fasting we found out is it reduces the cholesterol in the body. So giving your body that break from eating actually reduces the cholesterol. And there is some evidence to suggest that memory is better, and studies that have been done in mice show that mice that are fasted essentially have more protection inside the brain, and there is some evidence to suggest maybe fasting can help reduce the risk of conditions like dementia, Alzheimer's, where memory loss is an issue. So there's a lot of benefits that have come out over the last few years showing the massive benefit of fasting. And fasting, if you think about it, is probably a little bit easier than some of the diets that we try to give to patients to tell you to cut out this and not cut out that. If we actually install a bit more fasting for some people, that might be much easier than avoiding this but not taking this, where in essence you can eat a bit more better on certain days and other days you could be fasting. So there's a lot of research going on looking at diet from that perspective. So I hope that's clear with regards to the benefits of fasting you can see on the slide. The other thing that fasting helps us with, God also tells us in the Quran, يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. So you may have taqwa. You may have God consciousness. God says that fasting has been prescribed for you as a medicine. God's prescribing it. So you may have consciousness. You may be aware of God. So all that includes an element of self-discipline as well. And so fasting gives us an opportunity to regulate ourselves and have better control. So habits like smoking, and you must know people that do smoke stop, of course, during the time of fasting in Ramadan, and they're able to stop for quite long periods, and that's great in a way. A lot of willpower, a lot of control. So fasting gives us an opportunity to reflect and think, hang on a second, some of these harmful things, we might have a bit more self-control to try and help with these things, along with other strategies, of course, with regards to that. Obesity. People who normally tell you, you know what, I can't stop eating. It's really hard for me to lose the weight. It's really hard for me. They do really well in Ramadan. A lot of Muslims, mashallah, they're able to spend a lot of hours during the day as an answer to God, of course, and being devoted to God. They're able to spend lots of hours during the day, not eating anything at all, let alone cutting out this or that. They don't eat anything at all. So again, fasting is an opportunity to again reflect and build that self-control up and have some goals for after Ramadan with regards to how we approach our food. So in Ramadan now, I wanted to go specifically into fasting and Ramadan. We completely change our eating habits in Ramadan, and we have two meals essentially, one iftar and one suhoor. So I've told you a lot of benefits of fasting. You might turn around and say to me, well, look, Mahmoud, at the end of Ramadan, I actually put on more weight than the beginning of Ramadan. I've put on more weight, or the benefits might not be that great for some people. And the reason for this is that you need to do it properly from a health perspective. So if you're, for example, fasting the whole day, And then when it comes to iftar time, you're grabbing that cake. If you eat your zigni or injera, you're eating all those oils and zigni non-stop. And then those greasy samosas you're putting down your body, and you're eating 10 of the sweetest dates you can find. So suddenly you've eaten for 2 days worth of food within a few hours. So this, of course, situation is not beneficial in terms of a health perspective with regards to fasting, because what your body's done, it's done a really good job of improving, we said, the way the insulin is working. You've given it a break. We know that even the gut cleans itself out. There is a physiological process called the migrating motor complex, where the gut cleans the food out of the gut, but that only happens after a certain amount of hours of fasting. So all of these nice things have been happening inside your body. Your body's trying to improve, and all of a sudden, what do? When you're eating recklessly, you throw all the sugars at it. So suddenly there's a huge swing in the blood sugar levels. So your insulin is overwhelmed. Your body is overwhelmed by the amount of sugar that you've thrown at it. This becomes actually harmful to the body. And so there's a potential for Muslims when it comes to fasting. I wrote there, we have two big swings in our blood glucose levels. So there's a potential that the body is essentially hit by two massive swings of sugar, which aren't very good in a way. So what we're doing in a way is we're not really helping the benefits that we've set ourselves up with throughout the day. So what I want to discuss with you, inshallah, is how you can actually continue that benefit even when you break your fast and you eat the food, so it complements the good work you did. Because if you ended up eating every 2 days worth of food, as I said, it's not very helpful. So the question that we always get asked is, okay, fine, what shall I eat then, doctor? And doctor always tells you to exercise, and doctor always tells you to make sure you have a good diet. But what is a good diet? What shall I eat? This is quite a common picture that you may have seen before. You may have even seen it in your doctor's GP surgery on a poster, and it all looks a jumble, and it might all look a bit confusing. But essentially, I want you to take away a key message from it with regards to how we should approach what type of foods we're having. So again, that question, what diet shall I have? What's the best thing shall I eat, doctor? There is no magic answer. There is no answer that tells you this is what you should eat and you'll be perfect. If you have a low carb diet, you're perfect. If you have a high fat diet, but you cut this out, you're perfect. It doesn't exist in essence. Your body, Allah has created it essentially needing a lot of things in balance for it to function really well. There is definitely foods that you should avoid. So there are definitely do not do's, and there are other things that you should do in certain proportions. So you can see at the top of the pyramid over here, you can see we have crisps, we have Coca-Cola, we have chocolates, we have cakes, we have biscuits, all the stuff we love to indulge with in essence. What is the recommended allowance for this type of food from a medical perspective? In essence, there is no recommended allowance because this food is not really part of a healthy diet. So there is no recommended allowance, but what we would say is it shouldn't be done every day. So you should try your best to have a day that's off when it comes to some of these cakes and all of the sweet things that you enjoy. And if you're doing it every single day, then this particular Ramadan, what I propose to you is this type of food alternate. So one day you may have it, the next day you won't. If you can't stop, then I would recommend that you try and alternate, at least where you're giving yourself a break of these types of food. And you certainly shouldn't be eating huge amounts of these types of foods after a long day of fasting to suddenly hammer your body with all these sugars. It's not very good. The next bit in the pyramid that we're looking at over here is fats, oils, these sorts of things. The recommendation for this is in very small amounts. So you can see with the pyramid here, it's really small at the top and it gets bigger and bigger as you go down. There's very good reason for that. That means that the amount of food that you should be eating more of is further down. So these, the bottom of the pyramid should be more of what your diet is about. So if your diet is flipped the other way around, so the top bit is actually the bigger bit in the pyramid for you, so chocolates, cakes, crisps, or Coke, this is a sign that you're in trouble, and should be doing something about it, and seeking help in that regard. So going down, so the smallest bit is this horrible foods at the top, and then going down, the fats, the oils, we say small amounts in that regard. And then going down, when it comes to meat, chicken, fish, eggs, beans, and nuts, this we say 2 servings a day. And what we mean by 2 servings is using your palm, that's 1 serving of food. So 2 servings of these, essentially, that's the quantity that you should be having in a typical day. Obviously, when you're fasting in Ramadan, you might not be able to achieve, everything that you should be having in a typical day. And I think that's a good thing for the majority of us. We actually need a bit less calories for a while to help detox our body. And then further down, we've got milk, yogurt, and cheese, and these sorts of things. We're talking about around 3 servings a day. Now, obviously, milk and yogurts you don't have with you can't use your palm. So for that, we use 1 serving of cheese is essentially 2 thumbs. You can see on the poster, and the milk and the cereal. The cereal is further down. Some like 200 mils will be the milk is 1 serving. So you might have 1 of each, so a bit of cheese, some milk, 200 mils, and some yogurt. So 3 servings essentially of these things. Then we go further down. This is a bit more what our diet is actually sort of based on in a way. We've got the carbohydrates. Now, sugars actually fall into a category, big group called carbohydrates. And there are different types of carbohydrates. Some of them, like the sugars, like you have in your fizzy drinks and your cake and your chocolate, they're called simple sugars, and generally they're not very good for you. These types of carbohydrates are called more complex carbohydrates. These are much better for you. So potatoes, brown bread, anything that's whole grain, essentially, the Weetabix over there. What this means is, when you have, the reason why we love sugar so much is if we have a fizzy drink, it's quick. It hits the bloodstream really quick. We feel excited really quick. It hits our brain really quick. It makes us feel happier quicker. Now, with the complex carbohydrates, or what I call the slow release, or what is called the slow release carbohydrates, like the brown bread, like your Weetabix, all of those sorts of things, your rice, these things actually hit the bloodstream slowly. So they're better. They're much better than the sugars. So having these foods, and with rice as well, try and not eat too much white rice, more brown rice. So things that are more whole grain, more natural, and not really refined and changed, are much better. So brown bread versus white bread. White bread is a bit more refined, more sugars in that regard. Brown bread, a lot better, more natural, and that releases in your body a slow source of energy that happens over a period of time. And when it comes to fasting, as we will discuss shortly, these are the ones that are actually a lot better and more useful to our body. So, and then at the bottom of the pyramid, essentially, you've got all the fruits and vegetables there, and they should try and occupy a lot more of what we should be eating and drinking. So, okay, let's focus. So now the question, even more focused, is what shall I eat? So I would recommend for your iftar to start off maybe with 2 or 3 dates. Don't overdo it with the dates as well, because alhamdulillah, they're good for you. Of course, they're sunnah in that regard. You've been fasting the whole day. If you eat 10, 20 dates, that's a lot of sugar straight away. So 2 or 3 dates to break your fast. At that point, you can decide to have some water and do your salah. In terms of the rest of your iftar meal, pasta is better than, for example, white rice. The pasta is more whole grain. It's slower release energy. So your body is not overwhelmed with all the insulin. It's not overwhelming the body. So that is better for you as a more complex energy source in a way. And we say grilled food versus fried food. So lots of these greasy oils, they're going to put more fat in your body. They're going to give you bad cholesterol. So we say where possible, you have to reduce the oil. Samosas, if possible, bake them in the oven. If not possible, fry them with very shallow oil. Avoid deep frying, lots of oil, all that grease. And where possible, use olive oil compared to sunflower oil. And if you want a treat, you eat fresh fruits, mangoes, sweeter fruits if you like, watermelons, not excessively, of course, compared to sugary sweets. This is what we would recommend to try and move towards, in essence, when it comes to iftar. Similar thing when it comes to suhoor as well. Having porridge, slow release energy, will stay in your body longer, will make you feel like you have energy for longer. The porridge, the Weetabix, these types of foods, the fruits and vegetables, again, compared to sweet foods. You can obviously have some brown bread. Again, that will give you slow energy for the rest of the day because you're about to start your fast, in essence. So this should be more your focus. Okay, so that's food in summary. And the message that I want to get across in terms of fasting in Ramadan essentially is that, if you just give me 1 second, I apologize. Okay. So essentially the message that I want to get across to all of you, inshallah, is that we can make the fast beneficial, the benefit of having, all of those things, reduced insulin resistance, so less heart problems, less problems related to sugar problems, diabetes, all the health benefits that we can get from the fast is there if we eat properly during the time that we're not fasting. So this is the key thing that I want to get across from a health perspective. And you don't need to change everything. This might seem overwhelming for you. If you don't have fruits and vegetables in your diet normally during iftar time, I suggest you do. If you're constantly frying things on oil, if you can change that, change that. Pick 2 or 3 things that you can focus on and that are going to make a big difference, because this is the way you're going to eat for the next certain amount of days. And as I said, a good diet is essentially a balanced diet. So if you look at these categories and you think, Wallah Mahmoud, I don't eat any of this, or I don't eat any of this, then you know that you're missing out essentially. If your diet is very focused up here and there's not much in the other categories, then you need to worry, because the other categories should be more of the diet, and these treats should be much less of the diet. Okay, I hope that message is clear. Now moving forward, I thought of talking about common problems very briefly, before I open up to questions that people have during Ramadan, because these are typical questions that my patients will call me about and Muslims will call me about to discuss. So I thought it would be a nice idea just to talk about them. Number 1 is heartburn. What we mean by heartburn is acidity. When you get all that acid in your throat, when you're trying to sleep before suhoor, maybe you're feeling acidic, it's all not very nice in your tummy. That's partially because of the foods that we're putting inside. So we have to look and see, are we having a lot of oily food during iftar? Are we having a lot of spicy food? Are we eating too much? So if we're eating too much all at once, again, that's bad for the body, but at the same time, the stomach doesn't like it. That's why it's not going down as well, and it's causing us all of this heartburn. The other thing is we like our boon, we like our coffee. If you have too much boon, what does that do on an empty stomach? It's not very good, is it? It ends up irritating the stomach, causing burning, acidity, causing problems in that regard. So you need to try and maybe weaken that boon, maybe mix it with a little bit of milk, or take less coffee during the fasting time. Again, that will reduce your heartburn and all of those sorts of things. So a good possible, and if you need any medication, things like Gaviscon, or speak to your local pharmacist. They might be able to give you tablets like Nexium. There is medication out there that can help if you have a lot of heartburn, even while you're trying to correct your diet, or if your diet's correct but you're having lots of heartburn, please speak to your pharmacist, who should be qualified enough to help you, and you might not even need to speak to a doctor. Second thing is headaches. Headaches and migraines are very common. I'm sure a lot of you experience this. Again, it's part of things that can help with regards to this is, number 1, drinking lots of water. We know being dehydrated is not very good. And if you're going to binge on something, if you're going to take lots of something, I would say it should be the water. But don't try and do it all at suhoor time. All you're going to do is have a big bladder and be passing lots of water in that regard, which is fine. But if you can try and start your water intake at a good amount all the way from iftar and have lots of water throughout the process, again, it gives your body the opportunity to absorb all of that water. And that water will mean that you're better hydrated for the next day of fasting. And that might reduce the chances of you having a headache. Caffeine. So people that have too much coffee, of course, during fasting time do struggle. In future, may be difficult this Ramadan, but in future, before Ramadan starts, maybe 2 months, try and slowly reduce the amount of coffee your body needs. Very slowly reduce the amount such that when it comes to Ramadan time, you don't need that much coffee, so you're going to have less headaches. And of course, if you suffer from headaches, then make sure you get some good painkillers, like ibuprofen as an example. And again, if you don't know if that's good for you or not, I think it's important that you speak to your local pharmacist. Again, can help you with this quite easily in that regard. And having maybe some slow release carbohydrates. And what are slow release carbohydrates? These are the ones that we discussed already at the more towards the bottom of the food chain, where you've got more brown bread, the porridge, the potatoes, the pasta. All of these things are slow release carbohydrates. They're going to give you more energy throughout the day. So you're going to have less low sugars, less headaches, hopefully. So have a good porridge for suhoor. That might help reduce the amount of headaches you get as well in that regard. Dehydration is a common phenomenon when it comes to, not a common phenomenon, when it comes to fasting, it's a possibility. So again, make sure you get lots of water in during that time and get it over a long period of time, rather all at once at suhoor time. If you have water tablets like diuretics, for example, benzofurosemide, furosemide, all of these types of tablets, I suggest you speak to your doctor, because these types of tablets will dehydrate you a little bit more and may put you at risk of dehydration. Of course, if you feel really lightheaded, dizzy, not quite right, then please also take action. And it may mean that you definitely, need to break your fast in essence. So if you're feeling dizzy, you're not feeling quite right, you're shaking, all of those sorts of things, it means you need to get some water or some sugar into your body. And Allah has given us that concession, alhamdulillah, from His mercy, and we can make up the fast at a later date. God doesn't want us to damage our body with fasting. This is a very important point that I need you to take away. I have lots of examples and lots of stories of people that have done all sorts of things that are wrong by fasting and damaging their body. And that, in essence, is, of course, sinful. They're not getting reward. They're damaging their body. God doesn't want this. So if you feel dehydrated, dizzy, not quite right, another situation is hypoglycemia. It's uncommon in healthy people, but you might feel shaking, sweating, craving like you need some sugar inside your body. In that situation, you must act on those feelings, and you may need to break your fast, and you must break your fast. Otherwise, it will be dangerous for your health, especially in people who are sort of diabetics that are really well controlled and normally fast and don't need, for example, insulin, and normally are fasting well. In those situations, if you start to get sweaty, you start to feel, dizzy, not quite orientated well, you start to breathe a bit more, those are all signs that you need to get some sugar in your body quickly. Could be, sugary orange juice, Lucozade, and when you have the sugars in, also have some biscuits or a sandwich, because that will slowly release more sugars into your body. And inshallah, you can reflect on how you are fasting in this situation, and you can either make that up, or if your body is not able to make that up at any point, then God again has given you another concession to feed people who pay for people who, to feed them, inshallah, poor people. So there's a lot of concessions in that regard. Weight control. I think we discussed this already, and we said that if you suddenly eat 2 days worth of food within a few hours, you're going to have weight problems. Your body's being overwhelmed. The insulin's not working as well. It's not breaking things up, and so forth in that regard. So I think this talk has covered this in that regard. I think at this stage I will summarize and I'll open the floor to questions, inshallah, because I'm conscious of time as well and I have overrun a little bit. So going back to my original questions probably is useful to summarize. So I said, number one, what happens to your body when you're fasting? And we talked about the way insulin, it's that really important hormone that helps break down things. There are other hormones as well, but we focused on one of them that's important. And we said that a lot of positive things happen inside the body when you're fasting in terms of health benefits. And we said, can fasting harm you from a health perspective? I said, potentially. If you're binging and you're eating horrible foods, then it's not very good. And I gave you examples of ways you can try and eat more healthier, more slowly, smaller portions over a longer period of time, lots of water over a longer period of time. That's much healthier. And finally, I also said that Ramadan is a really good opportunity for us to reflect as Muslims, to be more controlled, more disciplined, and inshallah can deal with things like smoking, whether it's tobacco or even shisha, because people think shisha's okay, it's not as good or bad as smoking. Shisha's bad for you as well, believe it or not. And all of these unhealthy things that we do. I don't think people in our community chew tobacco much, but again, this is another problem and an opportunity in Ramadan to reflect and take this opportunity to try and improve. And if you want to stop smoking, there is a lot of help out there. All you need to do is speak to your GP surgery. They have stop smoking services and they can help you throughout that process if you want to do it. I hope that's clear, inshallah, in that regard. So I'll open up the floor to questions and we'll take it from there. Jazakumullah khairan. I'll stop sharing my
Assalamu
slide.
alaikum.
Alaikum salam wa rahmatullah.
Thank you so much, Dr. Mahmoud, for the discussion. It was very enlightening. I've got some questions that are in the comments section. Are you happy for me to go through them?
Yeah, I think it's better we focus on people's questions. So let's jump straight in and see what we can do.
Yeah. So one of them was asking, can you, would you recommend a specific food program for Ramadan that you would follow to have a better diet? And I think you were discussing that, you know, what things to replace in your diet. But is there, I have asked for the question to be a bit more clarified, but I wonder if it's talking about, you know, keto diets and this diet and that type of diet. Is there any specific recommended diet program?
Okay, so for fast, there are, I'm assuming the question specifically focused at Ramadan and fasting, so I will tackle it from that angle. I would recommend, again, as I said before, open your fast with 2 or 3 dates and then have a look at that pyramid. So I think it's, let me try and find it for you. Online, you'll be able to, if you just Google the food pyramid, you'll be able to see what is a balanced diet in essence. So if you start with 2 or 3 dates, if you decide that you're going to pick maybe a fish portion, and instead of, as I said, the more have complex carbohydrates, so brown bread or, you know, pasta with your food in essence, something along those lines would be a healthy start. And if you look at the pyramid, you'll be able to take different aspects of the pyramid, so at least you have something in each box. So if you Google food pyramid, you'll be able to have something in each box at the right quantity and pick one thing at the right quantity and inshallah take it from that angle. Key thing is cut out all of those greasy stuff, I would say, as much as possible as well in that regard, and have lots of water. I'm sorry if it's a very generic answer, but there is no, I would say, magic diets in that regard. But the key thing is just the quantity, number one, and having a balanced diet. Look at the food pyramid to show which foods you should be having more of and which foods you should be having less of. If you keep the quantities lower than, you know, in essence, than what normally people, unfortunately, because they've been fasting, eat lots, you will automatically weight. If you want to lose weight, you're going to lose weight just by eating less during that time.
Yeah. Okay. Fantastic. So the next question I have is my relative uses an inhaler for asthma, will that break their fast?
Okay, it depends. This is a question that you might need to present to someone who's a scholar, of course, a sheikh. There are different opinions. I'm going to be honest with you from the start. One opinion that I've been taught is it depends on the type of inhaler you have. So if it's like the blue puffer, the aerosol, for example, inhalers, then they say that that is fine and it doesn't break the fast at all. So I wouldn't worry about those type of aerosol inhalers. They're like the gas ones.
Okay.
Some say, yeah, so the gas inhalers, generally any puffy gas ones, they're fine, they don't break because a lot of them go straight into the lungs. Now, there is an opinion that other types of inhalers, like the powder inhalers, these get into the stomach. So there are a few ways to break your fast, but one way is something touching the stomach, and another common way is it nutritional or not, is the other question that scholars have. So some say that the powdered inhaler can potentially break your fast. The powdered inhaler is usually what we call a preventer. So these are inhalers that prevent you needing lots of the gas inhalers, essentially. And these we normally only use twice a day. So you might be able to have good control by using your inhaler twice, once during iftar time and once during suhoor time, especially if your asthma is stable from the powder inhaler perspective. And that might give you, that might get you out of that dilemma of does it break the fast or not. The key thing is obviously to stay healthy and make sure you don't do anything dangerous, because asthma is potentially dangerous if it's not well controlled. And get some advice from your GP regarding your specific medication, and also an imam that you trust in that regard. But I hope I've given you at least an opinion. So the gas, generally everyone's happy with, doesn't really break your fast during the day. The powder, there is a difference of opinion in that regard, and some say that breaks the fast when it hits the stomach in that regard.
Okay, that's really helpful. Thank you so much for the distinction as well. That's interesting. The next question I'm seeing in the box is there particular levels or types of exercise you would recommend while fasting?
Okay, this is a good question, I would say. Simply because remember where you're at in terms of fasting. Towards iftar time, your body has been really sort of depleted, your energy levels. All of us are a bit more down in that regard. And some people may exercise very rigorously during that period. That can sometimes be harmful because your body's already really down and suddenly you exercise really lots in that regard. So I would say when you're fasting, try and not exercise too strenuously overall and build yourself up. This is key. So don't sort of decide today, you know what, I want to be more healthy, I'm going to exercise and fast, and suddenly you're doing circuit training or you're pushing lots of weights and you're running around, you're going to drop. So I would say start off maybe by going for a walk if that's not something you're used to doing while you're fasting. So maybe a 20-minute walk, go for that. And then after that, build up to more rigorous walks. So walk really fast to the last maybe 5-10 minutes of your walk. Make sure you walk really fast such that you're panting when you get to your house. You're doing a bit of that. Then that means that the walk essentially is a bit more rigorous. And then you can slowly build yourself up. If you can tolerate a bit more exercise at home, then you can do a bit more in that regard. But you have to be careful that it's not too strenuous to the point that you feel really dizzy, and it's not all of a sudden like the HIIT workouts, so to speak, that are really intense all at once. It can be quite damaging. The other option is actually maybe flipping my argument a little bit, going backwards a bit, but maybe the last 10, 15 minutes or 20 minutes, if you're not making it, you make some dua, of course, but you might do some exercise and you're going to break your fast soon after that. Then you can do a bit during that time as well, safely, that you're going to have some food and water soon. But don't be too rigorous is the key answer.
Okay, that's very helpful. Thank you very much. The next question is, if you have a temperature, should you wait until Maghrib to take medication? And I assume he means take medication to manage the temperature.
This is a good question, but I think it's a very general question. and it would need to be tailored specifically to an individual. So by temperature, I take it we mean like a fever, that you're having. If you're feeling feverish and not quite right, then I think you should get some help with regards to that, if possible, some medical advice that's tailored specifically to you in that regard, and how you're feeling in that situation. But if you're feeling really run down, you're deteriorating, then definitely you should break your fast. If you feel you can tolerate it, and it's maybe a slight temperature, and you've got 1 hour left till Maghrib or something, then the situation might differ. And if it's a young, healthy person and there's not many problems at all, if it's a more older person, the situation will differ. So it's very hard for me to give a blanket answer that might cause problems to other people that are listening and take it the wrong way in that regard. So I would say get some advice from your doctor, or 111 you can call, or your GP you could ask at a later point. Don't call 111 just for that. If in doubt, obviously, look after yourself, because it's a very busy time at the moment. Calling 111, you'll be on the phone until iftar time.
So then you won't have a problem. You can just break your fast at iftar time. No, thank you so much. I think that one of the takeaways from that is if you feel that you are becoming unwell, that you seek help. Would that be the case? Because sometimes I'm not sure about your experience, but some people can be quite unwell but don't want to break the fast, thinking that they can soldier through it. Can that be more damaging?
Yeah, the principle is, if you, from an Islamic perspective, the principle is basically, my understanding is, if you're unwell such that the fasting starts to harm you, in essence, to make that illness worse or delays recovery of that illness, then you're allowed to break your fast. That's the principle overall. So if delaying breaking your fast is going to make you worse, or it's going to delay your recovery, then you're allowed to break your fast. But it really depends on the individual and how they're feeling. Is it just a mild snuffle? We call things temperature as well, but when you measure people's temperature, the temperature is normal.
Mm-hmm.
Maybe they have a slight cough and they're 20 years old and they feel fine and they're at home and they're not doing too much and they've got 1 or 2 hours. They can tolerate it, no problem. If they're getting worse, obviously they can break their fast. But someone older who's coughing a lot, has fevers, then, or even younger, coughing a lot with fevers, especially during this COVID time, then we'd say, be very sensible in that regard, and you have to be careful, not damaging your body.
Okay, no, I appreciate that. There are a lot of people with chronic health conditions. One of the most common ones in our community is diabetes. And they are on medication. So they might have blood pressure medication, they might have diabetic medication, which can vary from being tablets all the way up to being injections of insulin. They might have mental health issues where they're taking medication in the morning or nighttime. How should these people approach the fasting and what they do with the medication?
Again, that's a tough question, but a very good question. In terms of a general approach to this, is that, can your medication be structured in such a way that it can be, changed to the times between iftar and suhoor? So that's the first question you ask yourself. Can your medication do that? And in order for you to answer that question, you probably need to speak to your GP again. You can have a phone appointment to discuss, can your medication schedule be changed without causing yourself damage and harm and making you feel unwell in that regard. So if the answer to that is yes, that your medication can be managed in such a way that it can be structured at a slightly different time, and generally speaking, you're not really going to be much worse for the month, then inshallah that's positive from being able to fast perspective. I would say so with diabetics, again, the question is control and the type of medication they have. If you're on medication like, for example, a glycoside, people may be on this type of tablet. This particular tablet can cause your sugar levels to come down quite low, and that could be unsafe. for particular individuals. So we need to tailor the answer to them specifically and what type of tablets they have, not just insulin and tablets, but what type of tablets do you have and how is your control? If your diabetes is very poorly controlled, you have had situations in the past where you've had sudden drop in sugar and you felt very sort of dizzy and not quite right and you needed sugar because of a very low sugar, then if you've had those scenarios, then you yourself are more of a at risk, sort of a higher risk diabetic person, if that hasn't all been controlled and brought down at a good manageable level. So it depends on what type of control that diabetics have and what type of medication they have. Of course, if you have insulin, that makes it even more difficult. And generally the advice for diabetics with insulin is they should be avoiding fasting in a sense, especially the type 1 diabetics. But as I said, it depends on the individual, and inshallah you can get a tailored answer. People who are checking their blood sugars or are able to check their blood sugars and are diabetics, then this is also a good thing to do. If you're very well controlled diabetic, your tablets can be managed during iftar, suhoor time, you don't have very low crashes in sugar, then you can get a monitoring machine just to keep an eye on the sugar and make sure you know what numbers are good and what numbers are bad. So you can also monitor yourself in that regard and be able to fast healthily. So it depends on the individual. So there's no one size fits all or one answer fits all. So I recommend, inshallah, that you have a chat with your GP and book a phone appointment.
Okay, that's really helpful. So I think one of the takeaways as well that you mentioned is that your GP, your own doctor, knows the severity of your medical condition. They know what type of medication you're on, and they understand, do you have to be on this all throughout the day, or can it be structured, after iftar, before suhoor? That's very helpful, because sometimes I've, personally, experienced that some people don't talk to their doctors, and we find that they've just stopped their medication, or they've changed the dose, or they've halved the dose without any advice from the doctors, and we find that they can become quite unwell, which is quite risky for their health. And going back to, I guess, to the point you made about the principle that if this is going to make your health condition worse, then actually Allah subhanahu wa ta'ala does not wish for you to cause harm, and actually it's more detrimental. Thank you so much for that. On things that nullify fast, we talked about inhalers and whether they did. There were some other things regarding medical procedures. Does taking blood test nullify the fast?
Yeah, again, I think there is a difference of opinion when it comes to bleeding, but generally, no. From the opinion that I follow, that and there are lots of narrations where, for example, I believe the Sahaba even did, there's a hadith on hijama being done during the fasting time and so forth. So blood is, in essence, taking bloods, the short answer is, inshallah, you should be fine in that regard. But I'm conscious there are differences of opinion, and maybe ask a scholar you're more comfortable with in that regard, who's far more qualified than me as well, to if you want an answer that's tailored to you. But you should be fine from the opinion that I follow. The other thing I say is that, because I felt we're sort of, with regards to the medication, and people that are not able to fast but push themselves, and it can be sinful, as you said, it can be detrimental. Kemal, you mentioned, I think it's important for these people to also that aren't able to fast, to recognize that fasting is an ibadah at the end of the day. It's an act of worship, and you're doing it for the pleasure of God. And God has given you guidelines by which you should fast. So we shouldn't also see Ramadan as just fasting. We should be engaging in other ways of ibadah. If fasting is a struggle, Allah knows our situation. That's why He's told us to do particular things that He'll be more happy with, rather than fasting in that regard. But we can also do other acts of worship and just stay positive in that regard. So either way, inshallah, you get the reward for your intention as well if you're not fasting.
Thank you so much for that. There was one other question about what I had. If you have a drip, for example, so you're not taking a feed in through your mouth, but you have something put into your veins, whether that's medication or nourishment. Does that break the fast?
Okay, that's a good one as well. So with regards to injections or things that go in the vein, for example, whether it goes into the muscle or the vein, there is a general sort of principle in a way, in the sense that, is this giving you nourishment? So if you've got something in the vein, for example, as Kemal has asked, and there's a drip with fluids, then you are being nourished by fluids. You are being, and as such, that would break your fast, according to, everyone I know, that would break your fast in that regard, with regards to nourishment through the vein. Now, if you are having something that is not a nourishment, for example, you're having, I don't know, there might be a vaccine, inshallah, against COVID soon, inshallah, and everyone can go back to work and stuff. So if you have an injection like that that's protecting you from a particular disease, then that is not really a nourishment. So it's not a food in a sense, or a fluid. So that doesn't break your fast. Okay, I hope that deals with it. So it's not really where it goes, but is it a nourishment in terms of injecting you?
That's very helpful. Thank you very much. Jazakallah khairan. So just the last comment that I would like to respond to. Somebody's asked about what you mentioned about heartburn, but my recommendation would be that if they can replay the video, because it will remain on the page, that rather than you having to go through that all over again at this point. So there will be a recording which will remain on the Facebook page. So that sort of wraps up all of our questions. I really appreciate your time, Mahmoud. At this point, were there any sort of summary points that you wanted to make? And then at that point, I would like to sort of introduce Abu Moaz, and we can sort of close today's discussion.
Just Jazakallah khairan for the opportunity. I would say, great opportunity to be healthy during Ramadan. If you need any advice that's medical, again, as Kemal, you articulated, your GP knows your records quite well, so book a phone appointment is enough. And same thing with a lot of the Islamic questions that I handled. I just want to say that I'm not an Islamic scholar. These are opinions that I follow, that I learnt from teachers in that regard. Ultimately, God knows best with regards to these answers. And again, you can speak to a friendly imam, and I'm sure EMCA will be able to support you in that regard, who are hosting this talk today, inshallah. I pray Allah subhanahu wa ta'ala accepts it from all of us, and blesses us during this time that's challenging in that regard. Jazakumullah khairan.
And from me, I'd like to appreciate all the time that you've given us. Thank you very much. Jazakallah khair. So that's it from me. I'd like to appreciate EMCA as well for hosting this. So with that, I'd like to close and give my salam. Assalamu alaikum wa rahmatullahi wa barakatuh. And I'd like to hand over to Abu Moaz.
Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Mahmoud, Jazakallah khair. We enjoyed your presentation. It was excellent. And inshallah ta'ala, we try to apply some of the benefits, especially from the food pyramids, which I'm sure for some people is a little bit flipped maybe, but it was good talk. Jazakallah khair. Very short and also to the point.